Aloha everyone, and thank you for joining the COVID-19 Public Health Action webinar, Unsafe at Home, How to Help Someone Who is Being Abused at Home During the Stay-at-Home Orders. My name is Steph Moyer, and I'm the Community Initiatives and Training Coordinator for the Hawaii Public Health Institute. Before we get started, just want to go over some Zoom housekeeping items. For all questions, please utilize the chat box or question and answers box located at the bottom of your screen. There will be no continuing education credits provided through this webinar series. All webinars will be available on the Hawaii Public Health Training Hui's YouTube channel. I will be serving as today's moderator for the webinar, and it's my honor to introduce you to our guest speaker today. Angelina is the Executive Director of the Hawaii State Coalition Against Domestic Violence. Angelina is deeply committed to empowering women and families. Early in her life, she witnessed the intersectionality of domestic violence, race, class, culture, and gender in her community. That experience fueled her passion for changing the systems that serve, too often oppress disenfranchised communities, especially women and children. In her nonprofit career, Angelina has worked to address the root causes of poverty and trauma on the lives of women and children, first as a volunteer for Wahine Moving Forward, a financial literacy program for survivors of domestic violence, and most recently as the Director of Advancement for Hawaii Children's Action Network, a movement for children where she was responsible for fundraising, communications, and marketing. Angelina has also served on the board of directors of the Healthy Mothers, Healthy Babies Coalition of Hawaii, as the president of the Honolulu local chapter of the National Association of Professional Women, and most recently as the vice president of communications for the Junior League of Honolulu. Prior to moving to Hawaii, Angelina worked in various sectors of top-tier firms within the financial industry in New York City. She has a Bachelor's of Art in Economics from Connecticut College. So without further ado, I'm gonna hand it over to Angie.
Thanks, Steph. It's such a pleasure to be working with my former office mates at the Hawaii Public Health Institute and connecting with all of you on the neighbor islands. And thank you all for requesting more information about how domestic violence is impacting our community here in Hawaii. I know that we have been hearing certainly a lot of stories coming out of Europe and larger cities about the increase in domestic violence, especially those communities that are experiencing stay-at-home orders. And so we wanted to bring that information to you about how, what's occurring here in Hawaii and how, as public health professionals, you'll be able to help. We know that there are also some folks on the call and, Zooming in who are part of our general public community. So while this is, very focused on public health, we wanted to make sure that we did provide resources that anybody in the community can connect to and provide to anybody that they believe or know is being abused, as well as some, additional tactical things that folks in the public health field can recognize and actions they'll be able to take. Maka, next slide, please. So we just wanted to make sure that what the expectation is from us and what our learning objectives are. We want to define intimate partner violence. We want to recognize the various types of intimate partner violence beyond the physical abuse. We also want to make sure that, especially those who are working in the public health field, have a trauma-informed approach to questioning. We are going to be seeing a lot of folks now, certainly that we're going to see them coming in for COVID-19 tests, or we're going to see them coming in for various health screenings. And we just wanted to make sure that people know how to address any kind of abuse and violence that people may be experiencing. We also want to provide resources if you have a friend and how to help them during COVID-19. That's very different than what you might have done 2 months ago. And we also want to make sure that you recognize the connection and the role of domestic violence advocacy agencies. And we also want to connect you to local and national resources for domestic violence and sexual assault resources. We work with our Domestic Violence Sexual Assault Coalition and SATC. Unfortunately, they were unable to join us in the presentation today. I will not be speaking at length about sexual assault, but I'm going to provide the resources. And if you have any questions and concerns and need to be able to connect to sexual assault folks, just send us an email and we're happy to make that connection for you. Next slide, please. So the first thing you should definitely know is that, yes, our programs are operating, our shelters are open, our programs are still providing services. That has not changed with the stay-at-home order, that has not changed with any staffing allocation due to having people remote work. I would say that our programs have been incredibly creative and resourceful in figuring out how they're going to provide services to survivors in this new paradigm. And we'll share a little more about how they are doing that, whether they're providing text lines, chat lines on their websites, shelters. We've been working very closely with them about how to work with survivors or anybody who may show symptoms, et cetera. So I'll let you know that our programs are open. And our people should be calling them if they really have a need to seek services or looking for information on how to help someone. Next slide. So we wanted to give you, before we dive into the details, we just wanted to give you some perspective of how prevalent intimate partner violence is. And we want to also identify the fact that, yes, we are going to have a very gendered conversation. Here, we're going to mostly refer to women because 1 in 4 women in the U.S. have experienced some sort of intimate partner violence. But we do acknowledge that men are victims of domestic violence as well, and there are definite uniqueness about why they may or may not be reporting, and the number could definitely be higher. And those are all cultural considerations that affect that. But this is still a mostly gendered conversation for that reason. 1 in 5 women have been sexually assaulted in college. 1 in 5 tweens have been a victim of dating violence, and 2 out of 3 children have been exposed to trauma and violence. Next slide, please. Since most of you folks are in the public health field, we want to make sure that we just put this into a little bit of a context. So you're probably wondering, why are we going between intimate partner violence and why are we talking about domestic violence? And what's the difference? Or domestic abuse for that matter. So domestic abuse can be a broader term that would take into consideration, let's say there is sibling violence or violence between a parent and a child or a child and a parent. In this instance, we're specifically talking about intimate partner violence, where you're in an intimate relationship with someone, obviously. And then we're looking at it from the public health definition. And we're picking on this public health definition because it's more nuanced, and we hope that it starts to give you the ability to think beyond what the typical criminal definition of domestic abuse or violence that you might be used to. So you might be used to having like a physical abuse and showing physical symptoms. But what we're really dealing with when we're talking about intimate partner violence, we're talking about patterns of power and control. And it's a pattern of a behavior, and it's a choice that an abuser is making. And the reason why we're also using this public health definition is because when we're looking at it in the context of COVID-19, we want to really focus on the aspect of social isolation that stay-at-home orders will be exacerbating. So there is emotional abuse, there is stalking, there is intimidation and threats. And then the social isolation is already a key component. And we all know, we're all experiencing our own reactions to being at home, being with our neighbors at times that we're not used to being with them, or isolated from our own friends and family, especially for those people who are single. So we wanted to just make sure that we bring attention to that, because we'll be talking about it a little more. Next slide, please. So some of the dynamics that's important for you to know are how power and control is executed. So you'll see some of the typical behavior, like using extreme controlling behavior or jealousy, isolation, whether it's physical from your friends and family or emotional, using social status or privilege. We can talk about that a little more later on. But that also indicates that intimate partner violence does not happen to poor people. It does not happen to only immigrant communities. It's about power and control in whichever cultural setting that you're in. And then we know physical abuse, threats, verbal abuse, sexual assault is a key component of intimate partner violence, and reproductive coercion and emotional and mental abuse is part of it. You know, I think that these are very technical terms, but how it really plays out in our communities across the world is we tend to romanticize things like a jealousy behavior in terms of she really wants to communicate with me and know what I'm doing all the time. They really care. But this actually can turn out into an exertion of power and control over somebody's behavior. Isolation can be cultural, it can be familial, it can be geographic, and it creates divides in previously established relationships that folks may already have. You know, and we also have, you know, isolation where a victim is going to be forced to choose between a relationship and the abuser. So I think we probably have all seen this somehow play out in minor ways in communities and people that we know, and it's been super romanticized in media and movies as acceptable behavior. But when we really deal with it in the field of domestic violence, we recognize those as patterns of power and control. Next slide, please. We also wanted to, you know, make sure that folks in the community are aware that there are certain populations in our community that have unique controlling behaviors. And these tend to be underserved or unrecognized in the DV field because they are experiencing being outed to their family or partner, or if somebody has a particular medical diagnosis. For instance, in the LGBTQ community, they will be, you know, they'll be threatened and have to have that disclosed. And for people who are who have an immigration status, an abuser can threat to deport them. They will threat to take their children outside of the U.S. They will forbid them taking English classes, right? That will allow them to be empowered, to be self-sufficient, et cetera. So we just wanted to make sure that it's not, you know, that different communities have different, you know, different controlling behaviors that, as public health professionals, it's something to hear for and to listen to outside of what you might normally hear. Next, please. So you're all here because we want to talk about what power and control in COVID-19 looks like, in the COVID-19 environment looks like. And what we have seen and we've heard from other communities is now that somebody is home with their partner all the time, they will now use power and control and use COVID-19 as a tactic. So what that looks like is, you know, critical tools that we all need to remain healthy will then be withheld. So you'll look at hand sanitizer and disinfectants. They will use, they will misshare information about the pandemic in terms of frightening somebody and preventing them from seeking professional medical attention if they have symptoms, or they will withhold insurance cards or threaten to cancel insurance or prevent survivors from seeking medical attention if they need it. And we already see this, I mean, we see this with insurance and access to other services already happening, but COVID-19 is going to exacerbate that. And I would say that we all have a level of, we're all experiencing a level of stress about our ability to access healthcare during this environment. And there certainly have been a lot of questions about who's paying for COVID-19 tests, et cetera. We have worked out just with respect to insurance, we have worked out with our DV shelters and programs the ability to connect our to survivors, especially if they don't have health insurance because their abuser may have taken their identifying information, or they're now in an economic situation where they've lost it either through a loss of work, or their partner was the person who had the insurance and they've lost it, that they can connect with the public health centers, community health centers, and our programs are trained to either work with the public community health centers to get their clients screened, seek telehealth services, and at the same time also apply for Medicaid, or they can also do that online at the shelter with an advocate or any other advocacy service. So, so there is help, and there's medical health care available for people. And I think, like all of us, we are all concerned about going into public places with people that we haven't been living with for the last 4 or 5 weeks. So survivors may also fear going into a shelter because they don't know if they may be exposed to COVID-19 there, or they may be exposed to anything else. This is a very unknown. They don't know how long they're going to be in shelter, and definitely abusers are going to be using that to their advantage. We are not going to talk about this as much here, but we do have an elderly population that are survivors of intimate partner violence. And if they also have critical health concerns, they're going to be reluctant to go to a hospital to get screened because they might be exposed. They're going to be reluctant to go to a shelter because they might be exposed. With our elderly, or even anybody who has any type of disability, abusers will withhold their medication, will throw away their medication, will disallow people access to their accessibility devices. Now that an abusive partner may be home more often with them, they're going to be employing these tactics more aggressively and more aggressively monitoring. And the very fact that travel restrictions may impact how people plan to escape. So we know that survivors will leave when their abusers are at work, or in that period of time when they pick up their child from school but their partner is not home. And so maybe they plan to go to family in Washington. We have a very strong community on the West Coast, and we know how Washington State has been decimated. And is there a safe place for them to go to? Can they do a 14-day quarantine at that location, et cetera? So those are all things that are at play here for survivors. Next slide, please. So this is, I'm not going to go into the detail here, but we just wanted to give you an idea of a typical, like where the typical physical injuries may occur for a person who is being physically abused. So you may, I think that sometimes health professionals may be looking and questioning at any type of injuries or bruisings that may occur in these parts of the bodies that are very physically evident, but something to also take into consideration in your talking to people, especially if you have a patient's history or you've met with them already in the past, is to take a look at patterns around headaches and back pains and vaginal infections, digestive problems. I think we all know how stress, I think that's why Pepcid AC is so popular, right? We know how stress can manifest itself in digestive problems. Those are the types of things that when you're talking to somebody, when they may not be disclosing something about an abusive relationship, but it's something that you just may want to be questioning and sort of get to the root cause of what this is. The reason why we have bold the occurrence of head injury and strangulation, two really important reasons. First of all, if somebody has had a traumatic brain injury, it will impact how they show up to you. And, we in general may get frustrated with people who show up as forgetful, not thinking straight, their thoughts are not straight, they're not following doctor's orders, they're not following medication, etc. When you take a look at how traumatic brain injury, so somebody who's had their head banged against the wall repeatedly over time, um, that may manifest into those types of behaviors. So again, it's something to really take into consideration when you're talking to somebody in a medical or other types of settings. And over 2/3 of our survivors have been strangled at least once. So one main point about the strangulation has to do with the physiological impact of, your arteries and the blood flow to the brain, et cetera. But it is a significant indicator of the lethality and the dangerousness of the relationship. And that's why we're highlighting it here. Next slide, please. So those of you who are in behavioral health will see, folks who are experiencing abuse and intimate partner violence will be experiencing anxiety or depression, PTSD, antisocial behavior, etc. And research does show that women are more likely to use prescription opioids to self-medicate. So that gets to an important point about, I think that there's a big concern with people who are unemployed. Is, for instance, a question of, does unemployment cause domestic violence? Will that result in domestic violence in the household, for instance? And, if there's already some sort of intimate partner violence, the stress of unemployment for at least that primary wage earner or salary earner in a household will exacerbate intimate partner violence. We know that people self-medicate, and sometimes abusers will coerce their partners into using drugs as another method of power and control. So those are the types of things to understand about people who experience intimate partner violence. And I want to take a pause because I've been using the word victim and I've been using the word survivor interchangeably. And if I've used the word victim, we tend to use it in two instances. One, if we are talking specifically about laws and legal statutes, because they all use the term victim. But for the most part in the sector, we talk about survivors because we want to acknowledge that people may be experiencing abuse and they are survivors, and that's our a method of empowerment. And sometimes we will use the terminology of victim when we know that that person has died as a result of intimate partner violence. Next slide, please. So I mentioned it a couple of slides ago. Reproductive coercion is also a form of power and control. So folks who may be working with people who may be experiencing abuse, you ever wonder why somebody seems to have a lot of pregnancies, back-to-back children? That is a method that abusers will use. They will take away their birth control, they will sabotage birth control, they will force themselves into medical screening so that the survivor cannot disclose any type of issues with their relationship. And also, we know that survivors are more likely to have sexually transmitted infectious diseases, and over half the women with HIV have experienced intimate partner violence. Thanks, Maka. So why on earth would you not want to disclose this? I think that as long as the world keeps asking, why haven't you left? Why do you stay with that person? There will always be that shame, the judgment, the stigma. Um, Different families and cultures, you just don't talk about this kind of stuff. Only in doing this work did I ever realize and learn about the incidences of intimate partner violence that has occurred in my own family, and especially a particularly a lethal one, and nobody in my family ever talked about it. It was sort of a shameful thing that got shushed away. We don't openly talk about that. We don't openly enough talk about healthy relationships and what that looks like. And our culture overall does not model that. If you take a hard look at movies, we romanticize abuse, we romanticize stalking, things of that nature. So for somebody to break out and speak against that can result in social stigmatization. It is like the catalyst for more threats from an abuser and a whole chain of events. For those who have children, then children become a ploy in power and control, where custody is threatened or children are manipulated. And also the fact that, survivors themselves are not aware of what their rights are and what the laws are. And then you add, if somebody doesn't have, the best English proficiency, verbal or written, as well as immigration status, et cetera. They may be threatened to be deported. They may be threatened to have ICE called on them, or you can't go to the courthouse to get a TRO because ICE is going to pick you up there. So all of those types of things just really have, reasons why people may not want to disclose or to disclose their abuse. Next slide, thank you. So what we do know is that healthcare providers can provide a really safe place for people to disclose. And when healthcare providers are able to make the connection to resources, then people are more likely to disclose abuse. And it's really critical that you're making the connection to advocacy, counseling, protection, and shelters. We want to really emphasize this point. We don't expect you to take on the role of an advocate. We don't expect you to execute a temporary restraining order on behalf of this person. We know that that's not your skill set. You have many, many, many gifts. And part of what your gifts are is really to listen openly and generously and be able to make that connection to them in a way that doesn't have judgment, so that empowers survivors to make their own choice. Next slide, please. So especially for those of you who are in the, in the health field, we just wanted to let you know where our mandatory reporting laws are at the moment, right? So the duty of a physician, as many of you know, is to report severe wounds, et cetera. So, but you're not required to report domestic abuse unless somebody discloses that to you. So whether somebody discloses that it's emotional abuse or financial abuse, you are not required to disclose that. But you are required to disclose if there is, the typical like significant wounds on reports, the very same way you would do a stabbing or a gunshot. And next slide, please. So we want to talk a little bit about a trauma-informed approach to questioning. And I want to acknowledge right now that during COVID-19, that a lot of our healthcare resources are really focused on screening people and trying to triage people that are coming to hospitals. And so, it's highly unlikely that if you are part of a screening team through a drive-through COVID-19 test, you're probably not going to have the opportunity to ask many in-depth questions because you're not really getting any kind of a medical history on someone. But in those opportunities, maybe where you're providing some sort of telehealth, or that somebody's coming into your office, or, you're doing a home visit or telehealth home visit or something. There are ways that you can definitely approach a topic. And this definitely requires, there's a lot more that goes into it, but we just wanted to give you sort of a high level approach to it. So definitely the non-trauma informed approach that I have seen and I've personally experienced is no one is hurting you at home, right? Because if you got a question similar to that, you'd probably be very unlikely to answer that. But we know that if we ask them open-ended questions, right? Especially if somebody is having respiratory issues right now, and this person, for example, has asthma, and we are trying to take care of all of us who have any kind of respiratory issues. We're really trying to take care of that in order to maintain healthy, and also to not be triggered into thinking, oh my goodness, do I have COVID-19 because now I'm having my own normal respiratory issues might be triggered, right? So you may ask someone, oh, do you have access to your inhaler? Making sure you have access to your medication. Why would you or why would you not have access to your medication, or things of that nature? When you're talking to someone, you always want to make sure that you're making the connection that a healthy relationship will lead to better health outcomes. We want to make sure, and we know that this is hard already in the medical field, whether you're a substance abuse counselor or whether you're a nurse practitioner or you're a physician, you're going to, how to spend time and listen to someone without judgment. And then we want to make sure that you're making the connection to resources. Again, right, you're not an advocate, you are not a police detective, etc. We want this sort of line of questioning and our own implicit biases that underline our questioning to move away from why hasn't the survivor left to how can I support this person so they make their own choices. The domestic violence movement is very survivor centered and about providing as much information for them to make the choices that are appropriate for them at that point of time. Next slide, please. And we want to take a look at what safety looks like for survivors. And this is really important, and really why it's important for people not to try to pressure someone to leave. When someone tries to leave, it is the most dangerous time for them in their relationship, from the time they actually attempt to leave to up to 2 years later. And it also happens to be the most lethal time for someone. So it's really critical to not try to force someone to leave. And we know that we're in a particularly dire situation now where we don't know what options are available to people for them to leave, like where can they go to, right? We know that it just may be safer under normal circumstances to stay in the relationship or stay where they are. Sometimes their own safety and any violence is not their priority. They may have children, they're sharing parenting. Those are all many of the considerations that survivors are taking into account when they make that decision. And we know now that unemployment is higher. So the ability to then leave and provide for yourself and have health insurance and et cetera becomes another consideration as a result of stay-at-home orders. Next slide, please. Or not. Let's see if my slides will work. All right, so this is, the next slide after this have some more in-depth guidance from our partners at the National Network to End Domestic Violence, and we're going to include that as a resource. And then again, getting back to not putting you in a position where you are an advocate and you have to try to provide, safety planning, something that you haven't been trained in. How, as a friend, can you just help someone that is being abused or is in an abusive relationship? the first thing is to ask, how do you want to be, how do you prefer I connect with you? Do you want to use WhatsApp? Do you want to do instant messenger? Do you want to use a code word? We cannot stress this enough. Stay in touch, check in frequently, and be creative. And by that, we mean, it may not be appropriate to send a text and say, hey, how's it going? Have you, has anything happened? But maybe you both have school children in common, or maybe this is a relative of yours, and maybe you set up like a video chat between the kids, and you use that as a way to communicate, right? The next best thing is always be supportive, always believe in them, and help them think about how they can, potentially stay safe during COVID-19. So maybe it's, how to connect with advocacy services to create a safety plan appropriate for your situation, how to just make sure your cell phone is always charged, make sure I have a code word, etc. And the biggest thing that you can do is help somebody find domestic violence services. So this is really small, it'll be a resource, but this basically will take a lot of the high level, what I spoke about before, and go into some more details. And the reason why we are, we talk about advocates being the experts is an advocate is trained to understand and better to know the situation that somebody is in and provide the appropriate level of advice. Especially critical is safety planning. And advocates are trained to understand the dynamics of relationships and how they relate into lethality. So they'll be able to say, hey, I've got, we've got, like, this is how you would do safety planning. For instance, they would do something like advise them, okay, you tend to wear a lot of scarves, don't wear a lot of scarves, don't give yourself an opportunity to have that be used as a weapon. Make sure you're staying away from a room that doesn't have knives in it, knowing what your situation is, making sure you back into your driveway so you can leave. They'll be able to create a dynamic safety plan with someone that they'll be able to execute based on a mutual confidential conversation and training. And they're also able to help them around temporary restraining orders, legal advice, and all the other issues that they may be experiencing, like housing and support groups and counseling. And these are our local domestic violence advocacy partners. And what we've done here is we've specifically put our programs that are either have a 24-hour shelter hotline. So that means you can call and seek emergency shelter. And those the staff who are manning those phones are also trained in providing safety planning, advocacy, etc. So we have Child and Family Service has shelters on Oahu, East Hawaii Island, and West Hawaii Island. Parents and Children Together Pact has shelter on Oahu. Women Helping Women, they have a shelter on Maui and Lanai, and the YWCA has a shelter on Kauai. Domestic Violence Action Center, many of you may be aware of them. They are doing remote advocacy, and so you can normally call their crisis line, and now you can call locally, you can call toll free, and you're able to send a text to them. So that's really fantastic for people who are not able to access, be able to speak on the phone, and you can also chat on their website. And Legal Aid Society of Hawaii are still doing intakes. They're doing over the phone. So the number, they have representation on the neighbor islands, and obviously they have representation here on Oahu. So all of these resources plus more are available on our website. We wanted to also make available to you the local sexual assault resources on Oahu. That's Sex Abuse Treatment Center, Hawaii Island, Kauai, Maui, etc. have various organizations. Their toll-free hotlines are here. They'll also be on our website. And the Sexual Assault Treatment Center, they are still doing services. Victims or survivors of sexual assault are still able to get forensic exams. Their staff is provided with PPE. So if you know somebody who is seeking services are still available. Their exams are still available. You can still go to a hospital and get an exam. We've also noticed some national resources. If you're not able to reach any of our programs, you can always call the National Domestic Violence Hotline. They're available 24/7 and in many other languages. The Sexual Assault Hotline, the Trevor Project for LGBTQ youth, and the Trans Lifeline as well. And again, you can go to our website and you can get many other resources available there. Some of our member programs provide different types of services that may not be as emergent as somebody seeking shelter or advocacy right now. I did want to add in terms of the courts. We also have, thank you very much, I caught that, our Molokai shelter is open in 24/7, and that resource is on our website, so my apologies. I'll have to apologize to Karen Holt a little later. And yes, COVID-19 shelters, the shelters are still open during COVID-19. I just caught that on the chat, sorry. And just a quick note in terms of our courthouses are still open. They're processing temporary restraining orders. You do still have to go in person, and usually the best time to go is in the morning. And again, that information is available on our website and the link to the judiciary.
Awesome. Thank you so much, Angie. So we're going to open it up for questions now. If you haven't already done so, please put your questions into the chat box or the Q&A box located at the bottom of your screen. So Angie, the first question that we got via email is, could you address how Native Hawaiians are impacted by COVID-19 and domestic violence? And are there any good data sources that you could let us know about?
So I don't have data yet on the impact on Native Hawaiian population specifically for COVID-19, but if you go to our website, we do have, let me just open it up here. So we do have on our website the info sheet just developed by the Asian Pacific Islander Institute on Gender-Based Violence on Native Hawaiian communities. And actually, let me just try to check real quick if it's open on my website, but that's available on our website. So definitely, yes, we know that of the people who have been in shelter, that they definitely overrepresent, the Native Hawaiian community is overrepresented based on this data sheet here. Let me just, I was just looking at this yesterday. So it was published in February of this year. And so 21%, so with respect, so they looked at the behavior risk survey and the random telephone health risk survey of adult men and women across all 50 states. And 21.6% of Native Hawaiian respondents reported ever experiencing physical abuse by a former or current intimate partner violence. And that's just from a comparison, right, for our other Pacific Islander communities, that compares to 14.1% of our other Pacific Islander, 13.1% of Caucasian, and 6.6% of Black, and 5.9% of Filipino respondents. And there's more data on our website on that if you go under About, Data, and then Fact Sheets.
Thank you.
You're welcome.
So next question, it starts with a comment, but very appreciated about underscoring isolation. In my current capacity as a COVID investigator or monitor, we use a lot of words that can trigger or re-traumatize someone. So I'm having to do a lot of reframing or be mindful in the words that we use in public health, but still be very clear on the message. Do you have any best practices to recommend for this?
Yeah, you know what? Let me look up some best practices for that, because we know under a normal setting, just the sort of normal physical practice of like removing clothing, coming in, some people coming in potentially unannounced, etc. So let me get back to you on some better practices, and we'll, if you don't mind, we'll include that with the follow-up.
Okay.
Okay.
Good, thank you. Next question, are there measures in place to test survivors prior to entering shelters?
So all of our shelters here in all of our specific domestic violence shelters in Hawaii receive federal funding, and under our federal funding regulations, we are not allowed to pre-screen and deny anybody services for shelter. And that would include specifically screening in advance for COVID-19. Especially for a couple of reasons, right? So shelter staff are not medical professionals. So, you know, my like uptick in allergies that results in my shortness of breath and massive like congestion and coughing is really because I'm at home all day with a cat to whom I'm allergic to. But if, you know, if somebody were to present at a shelter with similar symptoms, we wouldn't want to have a survivor turned away by staff who's not a medical professional making a medical diagnosis. What our shelters are doing is following their normal protocol, which is really, they're gonna determine that they're eligible for emergency domestic violence shelter. And then once they are in shelter, they will address the physical needs that somebody may have. So if you can be completely you know, we know that people are asymptomatic and may be carriers of COVID-19 that may not manifest for like another 14, 15 days. Mm-hmm. And then we've worked with them about, you know, how do they triage and address that and have that person have access to medical attention.
Next question is, someone I knew, we came up with a catchphrase that they need help and call police. It really helped her. Should you set something like this right away? Especially if you are new to knowing the potential victim without misunderstanding the potential victim or labeling them or offending them, and they say, I'm not in domestic violence.
So let me just make sure I understand the question. So you're asking whether or not if you think that somebody has been is maybe experiencing intimate partner violence, and you're trying to determine a phrase that will tell you that this person needs additional help. Is that the right question? Is that my understanding of the question? I believe that is what they're asking.
So I think okay. It's a potential victim. Should you be setting a catchphrase with that person and have something set in place should they be a potential victim?
So it really, right, you should be guided by what the survivor wants. So when in your conversations with someone, if they happen to disclose to you that they may be experiencing abuse, one of the things that you can, obviously the first thing you can offer to them is you can offer resources to them. I mean, you know, one way to destigmatize it is that we offer the resources to all women, but that often just doesn't really happen. So offer resources and information and allow them to choose to take that information. And if they seem interested, you can, you know, offer to like have an exchange with them and say, if you really need help in something, let me know and we can agree to what that is. And both of you agree to whatever that phrase may be. It may not happen in a medical setting immediately because people may have trust issues, but maybe if it's somebody that you know, you might also set up like a code word or a phrase, especially something here, something that is not so obvious of I need help and like get attention. One of the things that I saw was really clever. I think we all know somebody who's selling either like makeup or essential oils, right? Multi-level marketing. So what I saw was really cool was there was a text exchange that you can have with someone and say, wow, I really love that new eyeliner. Can you ship it to me? Here's my address. And that's code for I'm in danger. This is where I'm located. Call the police and have them come here.
Next question we have
Mm-hmm.
is, does being home with the family cause more abuse? I thought being home would be good to be together since everyone is busy during the day.
I think it depends on the family dynamic. What we're experiencing is that what we know from survivors is that when the abuser is not working, for instance, so if the abusive relationship and the abuser is an essential employee, then they're not home all the time. But if that person is with you all the time, and they are experiencing an undue amount of stress because they're home because they haven't worked, or they're home because now they're trying to co-parent and teach, and try to figure out, am I going to get will I have a job in 3 months? That causes a lot more stress in a relationship, and it will just like deepen the dynamics of power and control that'll happen.
Next question is, are most of the DV shelters listed specifically for intimate partner violence? Are they available for elders being abused by family members?
That's a good question. I'd have to double check how many people come to shelter for abuse with another family member. I think one of my staff may be on like Slack. I think that's a great question. I'll double check on that.
Okay. And for all the attendees, the answers that Angie will be looking up, we will be sure to include those answers in our Mahalo email that will be sent out to everyone.
Okay, perfect.
Next question is someone I knew. We came up. Oh, sorry, already did that one.
Yeah, and it is reported to Adult Protective Services.
Okay.
As somebody mentioned, as a reporting.
Okay, sorry about that. Okay, so real next question. I have a client that is in an abusive relationship with her father and sister, whom she and her child lives with. There is power, control, as well as physical abuse happening. She does not have the means to live on her own at this time. The DV shelters are not accepting her because it is not an intimate partner. Do we see these types of clients falling through the cracks? Is there a way to include immediate family members in the description or criteria for the DV shelters? I have had this come up more than a few times during my 8 years working in DV advocacy.
Okay, that's a great suggestion. Thank you. We're going to take that with our programs.
Okay. Next question is, what is the best resource for our LGBTQ communities that are here in Hawaii related to IPV?
Sure. So just so you know, the LGBTQ community can still and should seek shelter from our domestic violence shelters. So for instance, if even if you, for instance, are transgender and identify as a woman, you can go to our shelters. And we also have on our website as well various sources for the LGBTQ community. Their Health and Harm Reduction Center, the Lavender Clinic, looking at on our website. It's all in our Get Help section of our website. Does that answer the question?
Yeah.
Okay,
we
perfect.
can put those links in our email as well. Next question is, do you have any suggestions for an approach to suspected IPV via telehealth, especially if you cannot be sure the abuser is not in the room? How do you get the survivors to talk openly?
I think that is actually the first, that really first critical step is to make sure that they are, I think the confidentiality is the key that's going to allow somebody to open up if they're ready to open up. And so I don't know if there's a way for you to talk under normal circumstances, what you can tell somebody, and this is something that'll happen even if somebody's physically coming to your clinic, is setting the precedent that, we do all of these, this is a medical, screening, and we're subject to privacy and confidentiality laws. You can cite HIPAA. and say that, telehealth works in exactly the same way, and try to see if that, if there's somebody is in the room, to, try to make the case in that manner. But you can, so I think, so basically, like, just try to determine if there's somebody in the room. And again, right, it wouldn't be a conversation of like, are you being abused? It would be, which would trigger if somebody's there, but it would be more of like, do you have access to your information or things of that nature? And you may have to wait to have that conversation until that they're in a private setting. I don't know if in telehealth you're able to do any chat features or connect with somebody afterwards, because that's potentially a way to connect with someone if your particular program has the ability to do a texting feature, and then just reminding her or him to make sure that they delete their chat.
Okay. So I think we're going to get to maybe 2 more questions before we have to wrap up. First question, have you been asking the governor, Lieutenant Governor Green, and the mayors to include DV awareness messages in their regular updates?
Yes, we have. Yes, we have since March. And it's almost May. The most recent thing that we've noticed is that in the recent Facebook Live with Director of DHS Pankaj Bano and Governor Ige, we have reached out to, they actually addressed the question with respect to domestic violence. And so then they listed all of the resources and all the programs. And so that's, so we're grateful that they were able to include that, but we certainly are, between the coalition and various member programs, constantly working with the executive branch to make sure that they're including messages around domestic violence.
Okay, and then this will be our last question. How can we prompt the news cycles to provide DV information, examples, contact information, shelters, etc., during every broadcast, and even the governor and mayors to address? So you kind of answered that, but maybe addressing the news.
I'm sorry, can you repeat the first part of the question?
Sure. How can we prompt the news cycles to provide DV information, like contact information or shelters?
We're actually working on that. After this, I'm going to hop on another call with some of the program leaders. So we're working on doing a public outreach and communication campaign about this. It has been, we definitely have done that. You've seen stories being picked up in the news. There was an editorial in the Star Advertiser, but we're actually working on a couple of PSAs, and we're recently connected as well with the various other language radio stations, because I've realized that so much of the COVID-19 information that has been put out in the community has been in English. So we want to make sure, especially as the coalition is doing social media, which we still know does not reach everybody because that assumes access to technology, that we're trying to get messaging in other languages. And so we're looking at different means to do that. So we're in the process of working that to have it be a much more coordinated effort and consistent.
Okay, thank you. I do want to apologize to those whose questions did not get answered on the webinar, but we will do our best to get those answered by Angie after we close today. But I do want to say thank you, Angie, for being our trainer today, taking time out of your schedule to be with us. Mahalo to all of you who joined us on Zoom. And lastly, thank you to all the HIPHI staff behind the scenes, making sure this webinar runs smoothly. Please mark your calendars for next week's webinar. Next week is April 29th. And please note, we are changing the time of the webinar. So we will be changing it to 1 to 2 p.m. Next week, we will be joined by the University of Hawaii Economic Research Organization to discuss how to control Hawaii's coronavirus epidemic and bring back the economy and what are the next steps. So again, please note the time change. 1 o'clock we will start. Mahalo again for joining us, and we hope to see you next week. Aloha.